Our first speaker is someone who has spent much of his career working to introduce and to improve culture change in health systems around the world, from Australia to New Zealand, from the UK to Ireland. He believes that time, rather than money, is the connecting currency in healthcare, and what that means in building a connected system which is centred around patients. Brian Dolan is the Director of Health Service 360. He is Honorary Professor of Leadership in Healthcare, School of Nursing, Midwifery and Social Work at the University of Salford in Manchester. He has published over 70 papers and has authored or edited 7 books. In 2018, Brian was publicly voted one of the 20 most influential people in the history of the NHS. And then in the 2019 Queen's New Year's Honours List, Brian was awarded an OBE for services to nursing and emergency care. The same year, he was awarded Fellow by election of the Faculty of Nursing and Midwifery at the RCSI. And then in 2021, he became the first nurse to be Honorary President of Agile, the Chartered Society of Physiotherapists network for physios working with older people. Will you please give Brian Dolan a very warm welcome?
Thank you very much, Audrey, for that very lovely obituary. So thank you all for being sent. My name is Brian Dolan, and it's an honour, a privilege to be here. And just watching Audrey earlier, that woman, it's just a pure professionalism. So thank you so much for the invite. And what I'm going to talk about for the next 5 or 6 hours will be around patient time and why it is that time, I believe, is the most important currency in healthcare. And how do we maximize time? How do we minimize wasted time? How do we value patients' time? Because while our time is busy and important, our patients' time is sacred. And what I want to show you is a short 80-second video, and it's called Your Last 1,000 Days. And somewhere in the back of my head, I had this thing that said, roll it there, Colette. Have a look, if you will, at this.
The day's almost over, the sky's about to show her the first glimpse of gold over waking up dreams. And thing is, I don't know why things that I felt so concerned with just let go and drift with the breeze. I've been running around looking for answers, and all of these days there still ain't enough. Like the moonlit late plains, let the questions just hang. All I need is time with your love. I've been running around looking for answers, and all of these days there still ain't enough. There ain't enough. Time with your love.
When you look at that, and full disclosure, my son, Will Dolan's a filmmaker and videographer with Firewood Pictures, and we commissioned him to produce this thing. And all of us can apply our own interpretation, our own understanding of what it is. We can look at those little vignettes. If you looked at them, looked at the narrative arc of life, starting with a child through to their mother's arms, and running is all filmed in Stratford-upon-Avon. And the dad leans over and kisses his partner, but what none of them know is she only has 1,000 days left to live. Or you see the teenagers all, chucking up their Doritos because Mayo has finally taken home Sam. We will. Sorry about the Burke family as well, by the way, can I just tell you. But from my father's village, he's still rolling in his grave. And the thing is, this film is dedicated to my best friend, Mark Mandel. And Mark, Paul, Joe, and I, like most people, many Irish people in the 80s, we were all exported from Ireland and ended up in England. And, we did our different things. And Mark walked into University College Hospital in June 2014 with acute abdominal pain. He'd been to his GP a couple of times, but they operated on him urgently. And by the time they transferred him back to Swindon, where he lived, about 10, 12 days later, they'd removed his descending colon where the primary was, but they also found cancer in his liver, his omentum, his mesentery, and his lung. So Mark was terminal from the get-go, and he lasted about 1,000 days. And then you see the image of the woman in the car and it's raining, and who knows what's going on there. Maybe she's been to outpatients at the Mater and been told, we thought it had gone, but it looks like it's come back. And she's now got to have a family conversation which will change the course of their lives. Or you see the couple dancing. Will's best friend that was his dad and his then brand new stepmother, and dancing. And then you see at the very end a young nurse walking around the bed, and the woman in the bed, and the clock ticks down to 1,000. And it raises a question I'd like you to all answer out loud. And the question is this: how many of your last 1,000 days would you choose to spend in hospital? What would that number be? Now listen, shall we all join hands and contact the living? If you had 1,000 days left to live, how many would you choose to spend in hospital? What would that number be? Absolutely. And it would be for our family, it would be for our patients as well. And the great Catherine Manning's beautiful book with the end in mind, that there's only 2 days that only have 24 hours in each lifetime, sitting like bookmarks astride our lives, one celebrated every year, and yet it's the other that makes us see living as precious. But when you think about it, it's not money and buildings that connects health systems, it's time. Access targets and waiting times, they are measured in time. Beds are not capacity, not meaningfully. Beds are just bits of furniture on which people wait for things to happen. You can open as many beds as you like, but if you haven't got the staff to look after the people in those beds. See, capacity as I see it is not about beds. Capacity is senior clinical decision makers and senior clinical action takers who can move the patient on in their journey. And we hear it manifest in language like, no matter how hard working our junior medical colleagues, our newly qualified nursing colleagues, our therapy colleagues, no matter how hard they work, they can't move a patient. Whereas the language we'll talk about is, what are we waiting for? Oh, we're waiting for the registrar to review the patient. We're waiting for the senior physiotherapist to listen to his patient's chest. The respiratory docs are happy, but they want her to have a listen and have a look. We're waiting for this clinical nurse specialist to look at this gnarly wound that we don't seem to be get up on top of. It's those senior decision makers. But also harm is frequently a consequence of time ill spent. Simon Jones et al. In a brilliant paper last year looking at all-cause mortality at 30 days found that and there was a sample size of over 5 million, that after 6 to 8 hours of waiting from arrival in AD, there is an additional death for every 82 patients. Harm is often a function of prolonged waiting and deconditioning. I created the End PJ Paralysis global social movement addressing deconditioning. And the longer people wait in hospital, the more harm that befalls them. And deconditioning is 10 to 100 times more prevalent than falls and pressure sores, and yet we're not capturing it. But then look at the work, the time every single day that we do is we're looking for equipment. There you are on the ward running around looking for an obs machine, and then you find two of them huddled together like survivors of the Titanic. And what have you done? Wasted your time. Waiting for people to call back. Something I know doesn't happen anywhere across the HSE. Being involved in pointless meetings doesn't happen anywhere I know of. And how many of you here are part-time? How many are part-time? How many are full-time? How many are not all that sure? You see, 65% of the budget in the health systems around the world is spent on time. Because salaries and wages are the purchase of the thing that's most precious, which is our time. But when you're working, the time flies by. You get to 11 o'clock and look at that, 11 o'clock, another child in the house washed. But if you are lying in a bed, time comes dripping slow. But if you are a person with a life-limiting illness, time becomes even more important, because a minute feels like 10. Waiting 10 minutes feels like half an hour, and half an hour, well, that feels like an eternity when you have a life-limiting condition. See, what patients want, I think, is they want to feel valued, they want to feel that they matter, and they want to feel that they are involved. The patients and their families are the most untapped resource in health and social care. But something I've thought about a lot is the care versus cure binary argument. And it seems to me that while cure is limited, because we all will, indeed we must die, it's what makes living worthwhile, is knowing that one day it will come to an end. But there is only so much cure we can offer. You see, we don't have intensive cure units, we have intensive care units. Because care is limitless from before we're born till after we pass. Care is endless because it values people, it values their time, it makes them feel they're seen, they are heard, they matter. And if you want to change a culture, it strikes me as a lot simpler than we think, and it's three-dimensional. And it's in this order of hearts, heads, and hands. The heart is the story, the purpose, the connectedness, the why. Heads, once you get it, because we don't make our decisions rationally. We make decisions emotionally and then often apply post hoc rationalization to what can be a terrible decision that people still believe in the face of the evidence. I offer you Exhibit A, Brexit, and Trump. You know, it's about the stories we tell ourselves. But once people get it, once people believe in something, you know, and as Nietzsche rightly said, when people have a good why, they'll deal with any what and how. But the what and the how is the strategy. That's the connectedness to why all this matters, how it works, what we're going to do, our direction of travel. And then the final bit, which is often also not always done as well as it could be, which is the hands. I believe in it. It's important to me. I get why you're doing this. I think it's really a good direction of travel. What can I do? Because when people have something they can do, then it starts to internalize and validates the whys around it. And the NPJ paralysis call, led by Deirdre Lang, the brilliant Deirdre Lang over here, Director of Nursing for Older People, who we call Get Up, Get Dressed, Get Moving, is when people have things to do, they will start to do them, and then they'll think this is why we do it, and they'll bring everyone else along with them. So the hearts, the heads, the hands. You see, organizations only progress at the speed of trust. And first people change, and then organizations change in that order. But we also perhaps, I think, need to rethink how we think about things. And as Adam Grant, the organizational psychologist, says, you know, 21st century literacy won't be about whether we can read or write. It'll be whether we can learn, unlearn, and relearn. And so maybe instead of thinking about falls prevention, which strikes me as a deficit approach to these things, maybe we should be framing it in terms of safer mobility. And I did a talk for, I think it was 300 falls prevention folk online a year or two ago, and it felt like Daniel walking into a lion's den, 300 people saying, I don't think your job title's quite right. And they all said, you know what, maybe it is about safer mobility, because you can keep people from falling by just keeping them in bed and letting them decondition and come to harm. What would it be like if you were a cleaner and reminded, actually, the most important thing you do is you keep people safe. You keep staff safe, you keep patients safe. So actually what you really are is a patient safety associate. Could you imagine their shoulders going back as I went into their family and says, you know, I'm not just a cleaner, I'm somebody who keeps somebody safe. Instead of talking about reducing length of stay, what about giving patients back time? Because then it's not a charge to do transactional reductions of fractions of days, but more about a value-based, values-driven approach to valuing people. Instead of talking about days in hospital, maybe we could talk, starting tomorrow, days away from home. How long has this person been away from home? Because once we shift how we think, then it actually becomes, well, let's get them back there. That's what matters to them. I was doing some work with Oxford, and they literally changed it the day after because they liked it. Some things they don't need an RCT or a big committee. It's like, we will change how we think about what we think. And maybe, too, about history taking, which increasingly feels to me has a kind of a neo-colonialist air to it. We are plundering a history, but actually nobody would come to me in the emergency department. The question I always ask them is, what's the story? Because everyone has a story to tell. And it's our job to mind that story. You see, it seems to be across Ireland that there's some people who are so poor all they have is money. But when you think across Ireland every day, there's a million acts of kindness to value people's time, to give them their dignity, their autonomy, their humanity. I don't think older people fear dying, they fear loss of agency. And I was saying to Audrey earlier about there seems to be two parallel narratives around the world of healthcare, where it's all collapsing, it's all falling apart, it's awful. And yet, when I was in Warwick Hospital before Christmas handing out the Recondition the Nation awards to them around the wards, the pride, the connectedness, the going home feeling today was a good day because that person didn't just feel they were cared for, they felt cared about. And we can have these overlapping Venn diagrams of reality. But it's also the days we go home and thinking, geez, I worked hard, but it was a good day because that person was better. You see, all of us in our different ways, what we are is we're memory makers. Because we sometimes may forget our patients, but they don't forget us. And that's what makes us social millionaires. And in the end, ultimately, it's about the last 1,000 days. So this idea came to, I know I'm better known for the NPJ paralysis work, but I was talking to a group, I'm more proud in some ways than this, I talked to a group of geriatricians and senior nurses and therapists about 10, 12 years ago in Christchurch, in New Zealand, where I also work in the integrated care system there. And we were talking about lean thinking and waste, and it just popped into my head that about time. And it strikes me, the average woman will live to about the age of 83, and the average man will live to about the age of 79. But if you are an 80-year-old woman or a 76-year-old man, what have you got left? And what you have is 1,000 days. Now, I know that the longer we live, the longer we expect to live. If you get past the age of 5, you've survived your childhood, so we get all that. But what are our hospitals full of everywhere? But what they're full of is people in the last 1,000 days. 48% of people over the age of 85 will die within 1 year of a hospital admission. A third of medical patients are in their last year of life. And I think our collective responsibility is to get people home to their loved ones, wherever they call home. And we'll know we're succeeding when there's people we never meet because they never have to come in to visit us as relatives or carers. But it's also about all of us as well. You see, I'm 60 on Easter Sunday, and I think more and more about my father, who used to say, I look in the mirror and see an old man, I have no idea who he is, because in my head I'm still 18. You know that kind of feeling? I'm going to be somewhere between 60 and death. But life is quick. The days are long, but the years are short. And one day, in a time that'll come blisteringly quick, I'm still in touch with all my classmates from Castlebar, the 10 of us who did our psych nursing together. We're always on WhatsApp chatting away. And we're all kind of bewildered how we are 42 years in nursing this year. But we will look back one day when we perhaps are in our last 1,000 days, and we can say, I never got rich, and I never got famous, but I mattered. I mattered to my family. I mattered to my community. See, there's this great line by John Steinbeck who said, far away in the future, 1,000 lives we could have led are waiting for us to show up. But when we get there, it'll only have been one of them. And each of us in this room could have chosen a different life. We could all have chosen lives where we wouldn't have had to work as hard. We could have chosen lives where we wouldn't have had to miss family events and weddings and parties because we were on call or we were working evenings and lates and weekends. We could have chosen lives where, let's be honest, we could have earned more for doing less. We could have chosen lives where we'd walk out at 5 o'clock on a Friday and not even think about the place till Monday at 9. But instead, what we chose in healthcare is we chose a life of service. We chose to be part of something bigger than us. And as a consequence, we all became social millionaires. And may I thank you for your time. Gur Mila Mahagwiv Galera.